Human body is highly complex. Metabolism takes place at all times inside our body in order to keep us alive and to enable our diverse functions. Simple examples are like how food, after digestion and absorption, is converted into energy and various bodily tissues, how aged or damaged tissues are renewed, and how the daily metabolic waste is disposed. Inborn errors of metabolism, IEM, are also called metabolic diseases. IEM are a group of rare diseases. IEM are genetic disorders, and majority are due to inherited mutations. Most IEM are autosomal recessively inherited. So, parents are carriers of the mutated gene and are not affected by IEM. Their children will have 25% chance suffering from an IEM, 25% chance normal, and 50% chance as an unaffected carrier like their parents.
IEM occurs because of inherent deficiency of a certain enzyme or cofactor, which in turn impairs normal metabolism, and toxic metabolites may accumulate, leading to damage to organs like the brain, the liver, and the kidneys, resulting in permanent harm and even death. Yet, if these disorders are diagnosed and treated early, most patients can lead a normal and healthy life.
To diagnose metabolic diseases earlier, the baby can undergo the newborn screening. If a baby is diagnosed with a metabolic disorder and is provided with appropriate treatment, the influence brought by the disease can then be lowered.
Newborn screening has over 30 years of history in Hong Kong. The Department of Health has been providing free cord blood screening of congenital hypothyroidism and glucose 6-phosphate dehydrogenase deficiency for all babies born in public hospitals.
It is difficult to detect metabolic diseases in a routine prenatal checkup if there is a known family history of IEM. Depending on the situation, tests such as chorionic villi sampling or amniotic fluid sampling may be considered to diagnose metabolic disease in the fetus. If the parents and the family are healthy, newborn screening for IEM can be carried out after birth to test whether the baby is affected by IEM or not. During the first booking visit by midwives, a pamphlet about the screening program will be given to the parents. Midwives will also explain the program to parents in greater details after delivery. If the parents agree, we'll arrange the screening for the baby. In the newborn screening, blood samples will be taken from the heel of the baby. The blood samples will be collected with a filter paper. These few droplets of blood contain significant information regarding your baby's health. The laboratory analysis generally takes about 2 to 3 working days. Chemical pathologists will review the test results. The reports will be released within 5 working days and can be found in the hospital clinical management system. Doctors can then check the reports anytime. Normal results will not be notified. If parents do not receive any calls from medical staff within 7 working days, it means the results are normal and the chance of being affected by the tested IEM is low. On the other hand, if the results are abnormal or uncertain, the medical staff will inform the parents within 7 working days and help arrange further tests or referral for the baby. Since some of the metabolic diseases are rarely seen and the symptoms are not obvious, the newborn baby who has the disease can appear normal as other healthy babies, even medical experts may not be able to diagnose it as well. Newborn screening can effectively screen the metabolic diseases. It also helps understand the health condition of the baby so that appropriate treatment can be provided. The screening can be performed on all babies. Even though IEM may cause severe intellectual disability, life-threatening illness, or death, some patients can be treated with medication or a dietary intervention if caught early. Most of them can live relatively normal lives. Therefore, we strongly encourage you to participate in the newborn screening for IEM.